Well, good almost afternoon. All I can say is wow, this morning's session has been really informative, and I've really gotten some benefit, and I hope you have as well. And I'm humbled to be here, and what I'm going to do is talk about this journey that we've been on with one of the work streams out of the Roundtable. Bill talked about the CEO Innovation Collaborative, and I'm going to talk to you about the journey that we're on and talk to you about Nestle's role in this journey, really to help to bring collective action in a community. And I'm going to start by talking about what we're trying to achieve in this CEO IC, and it's a lot about what you heard happening in Indiana. It's really, we feel like there's an opportunity to bring CEOs from business as well as other organizations together, CEOs that are really committed to making a difference in their community, to really foster health-promoting behaviors, and do this in a way that really brings sustainable action and ultimately impact. And so our goal is to do things nationally, but also at a local level. And so as we started to think about what we wanted to do locally, we focused on Cleveland for a variety of reasons, but it was the National League of Cities who actually put us in touch with a lot of great work that was being done in Cleveland. We learned a lot about what was happening in Cleveland, and also what we decided to do is take a learning tour, a listening tour. And so there was a group of the CEO IC that went to Cleveland. I'm a former Clevelander, so it was really a proud moment for me to introduce my colleagues to some of the great works that are being done in the community of Cleveland. We met with 70 individuals, over 30 organizations, and it was really inspiring to see what was happening in the community. The mayor's office was working on a Healthy Cleveland initiative, the county, and many others had a vested interest in really driving the health of the community. But the biggest observation we had coming out of this learning tour, or listening tour, was that business wasn't really engaged. Yes, you had the hospital institutions, but you really didn't have business engaged in the process, and we really saw this as an opportunity. Nestle has a vested interest in the community of Cleveland. We've been in Cleveland for over 90 years, and we have a very strong presence. We have 2,600 employees. We also created a new R&D center, a product technology center that we invested in and opened up last year. And we also have 2 manufacturing facilities that make Stouffer's and Lean Cuisine, as well as some of our food service products. So we have a long-standing commitment to the community and a long-standing presence. And the United States Chamber of Commerce has a 2-year relationship with the Robert Wood Johnson Foundation around the notion of getting business much more engaged in their communities. The campaign is called Health Means Business. The U.S. Chamber was aware of the work that the CEOIC was doing, and particularly in Cleveland, and the idea was that this partnership between Robert Wood Johnson and U.S. Chamber were going to host 10 forums in 10 cities. Cleveland was picked as one of those forums. Last week, we had the forum in Cleveland, and it was quite remarkable. We had 250 individuals participate in this forum, many of whom were business, but there were also non-business partners. We had the mayor, the county, and many others come together to talk about the inextricable link between a healthy population, a healthy employee base, and a healthy economy, and it just makes good business sense. And so we really started to have this dialogue with business about their role in the community. And what we were asked to do as Nestle is talk about what we're doing, not that we're a role model, but that we're a company that has a long-standing commitment to the community, and we also are doing things in the community that we want to help to inspire others to jump on board. So I'm going to walk you through a little bit of what we talked about at last week's session in Cleveland. And Nestle is celebrating its 150th year this year. We started as a company that created the world's first infant food to create a product for consumers to feed their children and reduce morbidity in Switzerland. So we've been on this journey, and as you heard about it earlier from Derek, we need to do a much better job of improving our product portfolio. But as we look to create a vision of nutrition, health, and wellness for this company, we know that our approach has to cascade down into the communities in which we serve. And so we talked about what we're doing with our employees, and you heard a lot about workplace wellness. And one of the things we talked about is what we've done with our parental support policy, which went into effect this January, where we're giving our employees up to 26 weeks off, 14 of which are paid. This is available for men and women and adoptive parents. We're also providing job protection as well as flexible workplace return arrangements and breastfeeding in facilities that have more than 50 employees. And we talked about this in this session last week to really help to be a catalyst to engage other businesses to take action. We created a coalition last year with 4 other companies to really be a learning coalition, because while this new policy could be seen as a cost, we really hope that businesses see it as an investment that will have returns, because we're really investing in our employee health, and the retention rates are going to be much higher, and ultimately we see huge benefits in this. So it really became an interesting discussion in Cleveland, and we invited other companies to join in this effort. We also talked about what you heard about earlier, which is how companies can directly impact the local communities through their employees. And we do this at Nestle by incentivizing our employees to give, both financially as well as their time. From a financial perspective, we encourage our employees to give to their local charities, and we match their donations as well as give them 2 days off. We also we provide significant ample time for our employees to invest in our charities. In Cleveland, it's 2 charities. It's the Boys and Girls Club of America, which is a phenomenal organization, as well as it's our adopted schools. And we invite our employees to go to the schools to introduce physical activity, teach nutrition, and we are encouraging other businesses in Cleveland to help join us in this effort and really be part of this collective effort that could have a much bigger impact in the community, because Nestle alone can't do this. We can have a much bigger impact if we do it together. And what we ended the conversation with is an invitation for other companies to join our collaborative. And the good news is, prior to the meeting, we had sent out the invitation, and we had 4 companies that had raised their hand and said, we want to be a part of a movement, and said yes. And we actually had a dinner with them the night before this session, and we actually had it at a social enterprise restaurant called Edwin's, which only employs former felons, and it's a training program to get these felons jobs in the food service industry. So it was an interesting forum for us to have this discussion. And then we had the meeting on the following day, and the good news is we got at least 4 other companies that have committed to being a part of this collaborative, and we're really looking forward to taking it to the next step and seeing how we can build on some of the great themes and ideas that you've heard from our fellow panelists today and really make a bigger impact. And so we're firmly committed to the fact that employees and businesses can have a key role in driving a healthier community that benefits not just the employer, but also other actors in that community. So with that, I'm going to stop. I know we're waiting for lunch, and we'll see if we have any time for Q&A. Thank you.